Hi, my name is Dr. Neeraj Agarwal. I'm a professor of medicine and director of genitourinary oncology program at the Huntsman Cancer Institute at the University of Utah in Salt Lake City. In this session of ASCO Direct, I focused on the cutting edge data in advanced prostate cancer, which were presented in the 2021 Annual Meeting of American Society of Clinical Oncology. I talked about the lutetium trial, the VISION trial to be more precise, which was presented in one of the plenary session abstract. In this abstract, which was presented by Dr. Mike Morris, in a randomized phase 3 trial of patients with metastatic castration-resistant prostate cancer who were heavily pretreated with the novel hormonal therapy and taxane chemotherapy, treatment with the lutetium-177 PSMA 617, which is a beta radiation therapy. Treatment with lutetium significantly improved overall survival as well as radiographic progression-free survival compared to patients. So patients who received lutetium therapy plus supportive care versus who only received supportive care, overall survival and radiographic progression-free survival were significantly improved. To be more precise, there was an absolute 4-month improvement in overall survival and a 5-month improvement in radiographic progression-free survival. This is a great news for our patients because not only we saw improvement in overall survival and radiographic progression-free survival, pretty much all secondary endpoints favored lutetium. So PSA responses, objective responses, and I'm sure we will see more data on health-related quality of life. With that, I think we expect lutetium to be approved by FDA very soon, and we will have a new drug for our patients in our treatment armamentarium for patients with metastatic castration-resistant prostate cancer. The second abstract was presented by Dr. Silke Gillison on an updated safety analysis of PEACE 3 trial, where she showed in an ongoing trial, which is a trial of enzalutamide plus radium versus radium-223 alone. For your quick recollection, radium is alpha particle radiation as opposed to lutetium, which is a beta particle radiation. So enzalutamide plus radium versus enzalutamide alone in patients with metastatic castration-resistant prostate cancer, use of bone protecting agents decreased the risk of fractures by more than 10-folds. So patients who received these agents, bone protecting agents, such as bisphosphonates or denosumab, had 10 times decrease in the risk of fractures compared to patients who did not. So these results tell us the value of bone protecting agents for our patients with metastatic castration-resistant prostate cancer. The third topic I covered in my talk, in this ASCO Direct talk, was real-world utilization of systemic therapy in patients with metastatic castration-sensitive prostate cancer. For your quick recollection, we have had multiple agents which were approved after showing dramatic improvement in overall survival in patients with metastatic castration-sensitive prostate cancer since 2014. And these include docetaxel, abiraterone, enzalutamide, apalutamide, and more trials are coming. But if you look at the real-world use of these drugs in a Medicare database analysis, which included more than 35,000 patients, and in a health insurance database analysis, which included more than 4,000 patients, we see less than 1/3 patients in 2018 and even 2019 receiving ADT intensification with one of these agents. This is clearly unacceptable. And I think the first step is to find out why our patients with metastatic castration-sensitive prostate cancer are not receiving these novel agents. Is it a concern for fatigue? A concern for cost? I think this is multifactorial. But at least as far as fatigue is concerned, I had the opportunity to present our updated analysis from the Titan trial, where we did not find any worsening of fatigue on treatment with apalutamide compared to placebo, even after much longer follow-up, approximately 4 years. So I think a lot of exciting data were presented, which have immediate potential or potential to immediately impact practice in clinic. So I look forward to you attending the ASCO Direct meeting and our talks, and hopefully enriching from those discussions. Thank you very much.